Hi everyone, welcome to the NCE 5-minute video review. We are under clinical focus and today we are talking about worry and anxiety, subcategory 8M. And worry and anxiety is a very common thing for counselors. Everyone worries or feel nervous from time to time. Anxiety is a normal human reaction to stressful situations. But for people with anxiety disorders, those fears and worries are not temporary. So that's something to really be mindful of. What is the severity as well as how long have you dealt with these symptoms? So anxiety persists and has a tendency to get worse over time. So anxiety disorders can severely impair a person's ability to function and function in multiple settings, right? Social situations, work, schools, with family, building those connections or lack thereof. Anxiety can also interfere with a person's relationships with family members, and friends. So, the social circle can certainly be impacted by that. But, and unfortunately, there's treatment for this. So it's not something that people just have to accept, right? So the different types of treatment can be, medications as well as counseling interventions, behavior treatments or counseling interventions, or a combination of medication and behavior treatment, depending on the severity, is usually what is recommended for individuals. So understanding anxiety, because it's not, one size fits all. There are generalized anxiety disorders, or GAD, and that is characterized by persistent worry or anxious feelings. People with this disorder worry about numbers of concerns such as health problems, finances, and may have a general sense that something bad is going to happen. So some of the symptoms of GAD can be restlessness, irritability, muscle tension, difficulty concentrating, sleep problems, and just feeling an edge. Another big anxiety disorder is panic attacks, and that is marked by recurring panic attacks that include symptoms such as sweating, trembling, shortness of breath, or a feeling of choking or pounding, rapid hearts, and feeling of dread. And those panic attacks are very sudden. There a lot of times there's not a lot of warnings, and people can experience them, often, and that can cause a great deal of fear. So then, they tend to avoid a lot of activities that they would normally partake in. Another area is the phobias. These are intense fears about certain objects. It could be snakes, spiders, it could be heights, planes, or situations, the heights and the planes, and that can cause a great deal of distress. Another category for the anxieties that you all should be aware of is social anxiety or social phobias. So these are people with fear of social situations. They can feel embarrassed or judged. And again, this is very different than, let's say, a middle school person feeling like they have an imaginary audience. This is, very impeding. They typically feel nervous in social settings. They're very self-conscious in front of people, and they're very fearful of rejection or offending others. And again, that can cause a lot of difficulty, right? Your social situations very limited, worrying, sweating, feeling nauseous, just a lot of worry. And then the post-traumatic stress disorder, so that that can tie in with the physical and emotional trauma, such as a serious car accident, being victims of a crime, being involved in wars, being in a natural disaster, so that can again cause a lot of very frightening symptoms, trauma, nightmares, intrusive thoughts, and that can go on for quite some time. So looking at interventions, you have Dr. Beck, who's kind of the cognitive father, and kind of the whole CBT. That's usually a recommended treatment, because it kind of looks at the connection between the mind and the behavior. It looks at the intrusive thoughts. Then it kind of looks at some of the interventions in order to intervene for those symptoms. So those are just some things that you all should keep in mind whenever the notion of anxiety disorders is covered.